brief and illustrative introduction of mine. Before going to proceed, I just recite one shlok, that is Ragadi Rogan Satanu Shaktan Sheshakaya Prasutana Sheshan Ausukya Muhar Digan Jagana Yopur Vaidya Namustasme. So, with due respect to all Vaidyas, I bow myself in front of all those Vaidyas and my text through which I gained such a big knowledge, and that's why I'm sitting in front of you and sharing my clinical insights on this burning topic. So in this series, first I would like to convey my thankfulness to the convener of this Vishwa Ayurveda Parishad, Agad Tantra Sambhasha, Professor Shobha Bhatt Madam, who has given me this opportunity to share my view on this topic, and all the team members who are effortlessly make these arrangements for organizing such kind of the presentations. So thank you for providing me this opportunity. In this series, I also like to thank my respected Vice Chancellor, Sir Professor Sanju Sharma Sir, who provided all the facilities to start this de-addiction unit, which later on we converted into the de-addiction center. And so that we get an opportunity to assess and evaluate different types of the patients of the substance abuse, and try to give the interventions and different clinical treatment modalities, and so that we get an opportunity to assess the outcomes through that interventions. So I'm very much thankful to him. And I'm also thankful to my head of the department, Professor Anita Sharma Madam. Initially, she saw this seed of this de-addiction unit, and later on, we just give the water and all the car and all those things. And that's why today this become a big tree in the form of NID Addiction Center, where different types of the substance abuse disorder patients came, visited, and admitted here for getting this detoxification treatment and de-addiction treatment in different domains. So, so with this, I would like to start with my presentation. Rather than it is a presentation, it will be a discussion. I would like to make it in more discursive manner. So let's begin. So, actually, is it visible, ma'am? Screen is visible?
Yes, sir. Yes, sir.
So as the madam allotted me this topic, that she insisted me to that you have to present the clinical insights on the alcohol de-addiction, whatever the outcomes we have received whenever we are giving the treatments to the different alcohol addicted patients. So I am sharing all those my clinical insights. So let's begin. These are the general trends. You are well aware, so I'm not going in detail, but it's a very burning issue that as the 2024, near about 283 million of the people globally affected with this alcohol use disorder. And this highest trend is mostly observed in the Europe and increasing trends in the Southeast Asia, which contributes approximately 3 million deaths annually, which constitute near about 5% of the global deaths. And as you all know, that this binge drinking is very much popular among the 80 to 25 years of the population, which where the peoples are, or this particular age group peoples are consuming the alcohol over a short period of a time in a large quantity, and indulge in which leads to the alcohol intoxication, severe alcohol intoxication. So this is a very burning issue which we have to address and highlight. If you see the trends in the India, near about 5.7 crore peoples, which is near about 4.6% of the population, is affected by this alcohol dependence, and the significant prevalence observed among the males as compared to women. That percentage is not that much serious, but among the women also, this alcohol consumption is increasing day by day. And if you see the state-wise distribution, Chhattisgarh, Tripura, and Punjab, these states are becoming the highest states while consuming the alcohol. And India basically ranks among the highest globally for the heavy episodic drinking. And 2.6 million people are affected with this daily law, that is daily activity lives disability loss. So in this way, this alcohol is directly playing as a etiological factor for more than 200 disease conditions like the alcoholic liver diseases, pancreatitis, different types of the cancers, neuropathy, and mental health disorders. So this is a very burning issue, and that has to be addressed, that has to be looked out through the Ayurvedic principles of means the Ayurveda principles. That is our aim. So what is the objective of this presentation of today's? So I always believe that whatever the things we read in the Samhitas or in the text, and then we have to analyze it, we have to understand it, and then we have to apply on the patients. And whatever that is basically, and whatever the outcomes we received, then we get certain sort of a proper outcomes through that, and then we apply it in a large scale. So that clinical experiences I would like to share today through this presentation. So the objective of this presentation is definitely to justify the selection of the Ayurvedic medicines using the classical text and the clinical reasoning for the alcohol addiction. To explain how Ayurvedic interventions target this gut-brain-liver axis and addresses the pathology of the alcohol addiction, and to highlight the role of the Ayurveda in the nutritional corrections, neuroplasticity, and relapse prevention. And whatever the theory and the text we read out, understand, that why I apply it on the patient. So to present that clinical outcomes, and in the case discussion and the patient responses from the NID Addiction Center. So before proceeding for the clinical case presentation, I think we should understand the basic theory. I know that you all are aware about the basic understanding of the pathology of the addiction, but still, being as a toxicology department, we are mostly indulged in understanding the toxicological aspects and the forensic medicine aspect, because it is totally a part of a psychiatry. And as you know, in the allopathic system of medicine, the psychiatrists spend their 3 years in this specialized branch to understand this particular branch. And then they are dealing with the different psychological disorders along with the substance abuse disorder. So it's very essential for the Ayurveda graduates and for the Ayurvedic fraternity to understand the basic pathology of the addiction, so that we can understand how we can break this pathology. So as you all know that most of the time it is understood that and most of the time the relatives of the alcohol use disorder patient is also thinks that they don't understand that why and how other people become addicted to this particular drug. And most of the time the people are thinking that addiction is not a disease basically, but it is basically a moral failure or a lack of a willpower. लोगों को लगता है कि भाई हमारा moral failure थोड़ा सा इसका ठीक नहीं है, या there might be a lack of willpower, वो ठीक ही होना नहीं चाहता, ये अपना शराब छोड़ना नहीं चाहता, ऐसा लोगों का thinking होता है. But basically that is a wrong notion. Though initially it is a bad habit, or it is initially it is considered to be a curiosity point of view, the students or the people are consuming the alcohol, but later on it becomes a disease condition. It becomes a complex disease condition which affects your brain, which affects your brain circuits, which disturb your neurotransmitter equilibrium, and then it becomes a big disease condition. And that's why the concept of the alcoholism and the other drug dependency as being a disease first surfaced early in the 19th century. And as you know, in the American Medical Association in 1956, they declared the alcoholism as an illness. And in 1987, the American Medical Association and the other medical organization officially declared the addiction as a disease. So you just see, before 1987, it is considered to be a lack of a willpower or a moral failure kind of a thing. But no one thinks that it is a disease condition. And in the present situation, in present scenario also, most of the family members also think that ye chhodna hi nahi chahta, he is not willing to quit from the alcohol addiction or any substance abuse conditions, or wo chhodna hi chahta nahi aisa unko lagta hai. But they don't understand that it gradually affects your brain, it gradually affects your different systems, and how it becomes a complex disease. They don't know. And that's why they are also very much reluctant that they need or they seek some sort of a detoxification procedure or de-addiction line of a treatment. So initially we have to accept that basically addiction is a disease condition. It is a complex disease. It is not a lack of a willpower, but it is a disease. So once you make and convince among the common society or the common people that it is not just a bad habit, but once the patient consume the alcohol or any other substances, that becomes a disease condition, and particularly it affects the brain, nervous system. So if you want to understand the Vasan, this particular Vasan word is mentioned in Charak Chikitsa Adhyay. So this addiction or this Vasan is particularly dealt in the Madhyay chapter. So we have to understand this Vasan, this substance abuse, through the lens of the Madhyay. For that, you all know this is a very common shlok which is mentioned under the Sharangdar Samhita. That is all the Madhakari dravyas, that any substance that disturb your intellect, that is buddhi, is considered to be a Madhakari dravya. Like they have given certain examples like alcohol or the similar agents like Madya and Suradikam. So any dravya which disturb your intellect, buddhim lumpati yadravyam madakari taduchyate. This is a classical definition of the madakari dravya, which disturb your intellect, which disturb your nervous system, which disturb your brain circuits, which disturb your equilibrium, a normal equilibrium of the neurotransmitter. All these comes under this category of the madakari dravya. And the classical example of this madakari dravya is only given, that is the Madya and Sura. But in this Madhakari Dravya, we can incorporate so many other substances also. So any Madhakari Dravya which impair your intellect when consumed repeatedly, which leads to the Vasan, which we call as addiction. And in the classical text, as you all know, that Madhya discusses in a large context, and that's why there is a specific chapter is there that is called as Madhyaya. So due to the Madhya, what kind of the Atyaya, means what kind of the disturbance or the pathologies occur, that deals under this Madhyaya chapter. But it represents a prototype for all the addictive substances that impair basically your buddhi, agni, ojas, and the sattva. So if you really want to understand the substance abuse, so you have to understand this Madhyaya Samprapti in a very proper way. And hence the Samprapti, that is pathogenesis of the Madhyaya, so as a model to understand the Ayurvedic pathology of the all substance abuse disorders. So this is Madhyaya as a universal model of a substance-induced disorder. So as you all know that under the Madhyaya Samprapti, it vitiates your Agni, which results in the Agni Mandya. It also affects your Oja. That's why the symptoms of the Ojakshaya is very significantly observed in the patients of the different types of the substance abuse patients, like Viviti, Durbhalu, Abhikshnam, Dhyayati, Vyatita, Indriya, Duchaya, Durmanachaya, Ojasakshamachashaya. These are the symptoms which is mentioned in context of the Ojakshaya, which we are very commonly observed in the different types of the substance abuse patient also. Similarly, it affects the different system, particularly the Manodosha Vruddhi are also observed in this context. And also it has toxic effects on the different dhatus, like Visham Hidayam Sampraptam Pragadusheti Shunitam. This is mentioned. So alcohol is nothing but a kind of a visha, which definitely not only affects the Rakta Dhatu, but simultaneously affect the multiple different Sevan Dhatus. Like as an example, the tobacco affects your Shukra Dhatu. So that's why if the person who are consuming the tobacco or the alcohol for a long period of a time, it definitely hampers the quality of the semen, it hampers the quality of the sperm also. So definitely it has a toxic effects on the multiple dhatu level also. So you have to understand, you have to analyze this Samadhyaya Samprapti all angles. And this process also involved in not only in the context of Madhya or the alcohol, but that also involved in the opium, cannabis or the tobacco abuse. And hence it is valid to extrapolate this concept of Madhyaya in the all types of the substance-induced disorder. So only Madhya is just a classical example of the Madhakari Dravya. That's why we relate this Madhyaya condition in a broader Ayurvedic model for the all addictive substances. But we can propose the new terminologies also. Like suppose due to the Madhya Atya, means whatever the disturbances occurs, that we label it as a Madhyaya, and we understand through the at the symptoms level and how it affects the different system, and accordingly we are analyzing the Samprapti and understanding the different symptoms. At the same time, We have also evolved the new terminologies also. This is because ये उक्त है, अनुक्त बहुत सारा है. We have to extrapolate that, we have to explore that अनुक्त things. Like अहिफेन की वजह से कैसे opium induced जितनी pathologies है, how can you decode these pathologies? So we can make a different chapter of ahifenatya. Means whatever the disturbances occur due to the ahifena or due to the opium-induced pathology or opium-induced disorders that come under this ahifenatya. We have to frame out the proper samprapti of this opium-induced pathology, their symptoms and all those things. And we can frame a different chapter for this ahifenatya. Similarly, we can do this bhangatya or tambaku. This is my just observation. That we have to explore these kinds of the concepts, and in all these samprapti we have to involve the Agni Dushti, Ojakshay, Manasvika, Vasan, and Vishakta Dhatu Avastha. And in this context, we have to thoroughly understand all these substance-induced disorders. So coming to the alcohol addiction, as today's topic is basically alcohol addiction and how we can do this alcohol use this, how can you treat this alcohol addiction through the Ayurveda. So with that notion, we have to first understand the alcohol addiction pathophysiology through the modern view as well as through the Ayurvedic view. So this is just a brief a flow chart. I'm trying to explain that how the chronic alcohol consumption leads to affect the different system and how it disturbs the gut, liver and the brain axis. So as you initially, most of the people or most of the individuals, they are consuming the alcohol with a peer pressure or with a curiosity. But later on, gradually the frequency and the amount of the alcohol get increased, and then they are landed into the chronic alcohol consumptions. And definitely that chronic alcohol consumption disturb your gut microbiome. Definitely, as you consume the alcohol, it enters into your stomach, it absorbs into the small intestine, and through the small intestine, it spread all over the body. So when it enters into your small intestine and the stomach, it disturbs your gut microbiome. Gut microbiome, basically, it resides in your intestine, or whole Mahasrotas is a site of this gut microbiome. So definitely that affects this gut microbiome because this alcohol is considered to be a visha, and that visha has a definite role on the different systems. Ultimately, it affects on the gut microbiome also. So that creates the gut microbiome dysbiosis, where it decreases the beneficial gut microbiome like lactobacillus and the bifidobacterium, and increases the harmful bacteria or increases the colonization of the harmful bacteria like E. coli or the Klebsiella. And definitely, as this gut microbiome dysbiosis occur, that also derived the because the short chain fatty acid, it is basically a gut microbiome derivative. If this gut microbiome dysbiosis occur, that metabolite also get disturbed. So that's why there is a decreased amount of this short chain fatty acids. As you all know that this short chain fatty acid is basically a gut microbiome derived metabolite which influences the neurotransmitter production, which is helpful for the mood regulation, which is responsible for the proper behavior. It also inhibits the pro-inflammatory cytokines. It also inhibits or reduces the systemic and the hepatic inflammation. It suppresses the hepatic regeneration. So short chain fatty acids is a very wide positive effects on the body. It maintains the tight junction of your gut. So it has very beneficial effects on your gut, on at the same time on the brain and on the different system. But as there is observation of this gut microbiome dysbiosis, so definitely there is a disturbance occur in the short chain fatty acids which impair the gut barrier and which results in the leaky gut, which damages the tight junction and decreases the mucosal immunity. And then the LPS, that is also this gut microbiome derived toxins. This LPS basically a lipopolysaccharides, which is a major component of the outer membrane of the gram-negative bacteria. So as the gut microbiome dysbiosis occur, there is an increased diversity of this harmful bacteria. And as there is an increased amount of this harmful bacteria, that leads to the increased amount of this gut-derived toxins, which we call as LPS. And this LPS get translocated from the gut and enter into the systemic circulation and travels to the brain and travels to the liver and to the other systems, which leads to the endotoxemia. And as it enters into the liver, definitely the Kupffer cells, which is resident macrophages in the liver, it also get activated, and that results into the increased pro-inflammatory cytokines in the form of TNF alpha, interleukin 6, and that increases the oxidative stress in the liver, and ultimately that results in the liver toxicity. So as you all, that visham hi deham sampraptam pragadushe ki shunitam. So this alcohol is basically nothing but visha, and that affects the rakta dhatu. And the raktava srotas moola sthan is yakrut and pr. Definitely it affects this liver. So liver toxicity is occur in the different forms, in the form of fatty liver, in the form of hepatitis and the cirrhosis, and so many other complications occur due to the liver cirrhosis. So in this way, this vicious cycle is going on. Similarly, that this pro-inflammatory cytokines like LPS, that also crosses the blood-brain barrier, and that affects the brain, the nervous system, and that results in the neuroinflammation. At the same time, that also increases the cytokines by crossing the blood-brain barrier, that responsible for increasing the inflammatory signaling in the brain. Also, that disturb the equilibrium of the neurotransmitters like dopamine and GABA and the glutamate. And so that equilibrium is also get disturbed because of this alcohol. And in this way, this brain reward circulatory dysregulation occur, and this vicious cycle occur continuously. And the patient initially only craving for the alcohol, later on it develops the tolerance, and after tolerance, he needs much more amount of the alcohol, and gradually it becomes dependent to that alcohol. And once he stopped to consume the alcohol, or once he stopped the alcohol consumption, or he reduced the frequency of the alcohol consumption, the alcohol withdrawal symptoms appear. And despite of the harmful effects occurring, not only at a physical level, but at the psychological level, at the social level, but still he continuously use this alcohol. So in this way, this vicious cycle goes and goes on. And in this way, it creates the negative neuroplasticity. I think you might be heard this neuroplasticity word, that nervous system has an ability, whenever which things you wanted to learn out, or whatever the things you wanted to learn out, our brain is developed the new synapses, the new neurotransmitters, or even if there is a damage conditions, the brain is shifted to the healthy nervous system, healthy kind of a thing. So nervous system has an ability to reorganize itself. So once the person consumes the alcohol frequently, the nervous system is framed in such a way that it becomes a negative neuroplasticity. So in this way, this vicious cycle get continuously occur. Similarly, we also highlight this nutritional deficiency, and that is very much essential, because most of the time in the alcohol addicted patient, lots of nutritional deficiencies, or particularly lots of vitamin deficiencies occurs. It is also because of this gut microbiome dysbiosis and the poor nutrient malabsorption and the poor dietary intake, because it affects your Agni. So most of the time the alcohol addicted patient having the reduced appetite, so they are just consuming the alcohol instead of the proper food and nutritious food, and that's why there is a lack of the supplements of the good quality dietary intake, and that's why that results in the thiamine, B12, or the folate acid deficiency, zinc deficiency, magnesium deficiency, and other essential components which is required for the proper body functioning. That leads to the impaired brain function and the enzyme production. That also leads to the it decreases the BDNF. BDNF is basically a brain-derived neurotrophic factor, which is a key protein which involves for the neuroplasticity, neuronal survival, synaptic regulation, cognition, and the memory. So this percentage is also get disturbed because of this nutritional deficiency. It also leads to the synaptic dysfunctions, and it turns to the negative neuroplasticity. Definitely, it also responsible for the neurotransmitter imbalance, because lots of the precursors resided in the gut, and once this gut dysbiosis occur, and so many nutritions or so many vitamins also plays a significant role for the neurotransmitter production. So that is also get disturbed because of this nutritional deficiency. And that's why it results in the emotional dysregulation, cognitive impairment, which results in the form of anxiety, depression, and the craving. And these nutritional deficiencies also lead for the severe alcohol withdrawal symptoms like delirium tremens. I think you all heard about this delirium tremens. This is a fourth degree severe alcohol withdrawal symptom, which is occur mostly near about 5 to 10% of the alcohol withdrawal patients. And the most prominent causative factor for developing this delirium tremens is the thiamine deficiency. Even the other contributing factors are also responsible for this delirium tremens condition. They like old age, how amount of alcohol you are consuming, in what frequency you are consuming the alcohol. These are the contributing factors, but definitely the thiamine deficiency also plays a very significant role for occurrence of this delirium tremens. Even other severe alcohol withdrawal symptoms like hallucinations, seizures, or the autonomic instability. So in this way, the nutritional deficiency definitely plays the significant role for the production of the severe alcohol withdrawal symptoms. And that also increase the risk of the relapse. And in this way, the person due to nutritional deficiency and reduced appetite and all those things, a person continuously use the alcohol use, that again was the nutritional deficiency, and this vicious cycle of the addiction and the brain injury occurs in a simultaneous manner. And that's why if the patient is still wanted to quit from the alcohol addiction, but as this system, all these systems are involved in such a extensive manner, so he's not able to, or he's not succeed to quit from the alcohol. And that's why we have to understand all the systems, particularly the liver, particularly the gut dysbiosis, particularly the brain and all those things. And then you have to frame out the line of a treatment. So this is the symptoms. I'm not going in detail. That initially there is a intense desire or a urge to use a substance, which often triggered by the environmental cues or the stress or the emotional states. And then gradually he started to consume the alcohol. Later on, he develops the tolerance. Means शुरुआत में अगर मान के चलिए he is consuming 50 ml of an alcohol, so he get that kind of an euphoria or the pleasant kind of an sensation. But gradually, the neurotransmitter addicted or neurotransmitter adjusted with that particular dose, and then he is not feeling that much of a pleasant sensation. And then the brain needs a much more amount of alcohol, and in this way, as the tolerance develops, there is a need to increase the dose over a time to get a same effect or a diminished effect with a continuous use of the same dose. So in this way, we can consider that the tolerance is developed in the patient. And how can we identify that? Initially, patient says that earlier मुझे एक या दो ही पेग लगते थे. Now I need 3 or more than 3 or 4 or 5. In this way, we can analyze that yes, the tolerance stage is achieved by that particular patient. And lastly, the physical dependence. And after craving and development of this tolerance, definitely the physical dependence is also developed. And this is basically a physiological state of adaptation to a particular substance like alcohol and the substance abuse, evidenced by the withdrawal symptoms when substance is reduced or the stop. So once the patient, how can we identify the patient has developed the physical dependence? That once the patient stopped to consume the alcohol or reduce the frequency or reduce the amount, he started to develop the alcohol withdrawal symptoms. And these alcohol withdrawal symptoms are so there are, we can delve in a detail that which are the first degree alcohol withdrawal, second degree alcohol withdrawal, and third degree, and so on. So according to the substance abuse, the alcohol withdrawal symptoms varies. So in this way, we have to understand the craving, tolerance, and the physical dependence. Now, this is the Ayurveda understanding of the addiction and alcohol use disorder. This is a quotation which is mentioned in context of Charaka Samhita, that initially they have mentioned the Prathama Madhavastha, Dvitiya Madhavastha, and Tritiya Madhavastha. And later on, in the last sentence, I have not quoted all the reference. You just go to the Charaka Samhita and refer the Madhatya Chikitsa, where he has typically mentioned that Vasanitvat Udar Kecha Sadukham Vyadhim Ashnuti. This is mentioned in the chapter 24, shlok number 40 and 51. And what does it mean? Vasanitvat. Here the vasan word is typically mentioned. Uh, Before going to that, when you are consuming the alcohol, it enters your Rudayam Avisham Swagune Ojaso Gunan Dashabi Dasham Sanshokcho Cheto Nayati Vikriya. So it all related to your disturbance your consciousness, disturbance your brain particularly. So Cheto means your higher brain functions like prefrontal cortex or the limbic system. Vikriya means this neurochemical imbalances or the cognitive dysfunctions. We can analyze, we can understand through these analogies, that is cognitive dysfunctions, dissemination, inhibition, and the loss of mental clarity. And in this way, initially, this affects your brain. You have good kind of euphoria we are getting, but later on, when you are consuming it frequently, it become a vasan. And in a udarka, udarka means uttara kalam, sadukham vyadhimiti madatte. So it is not a immediate outcome. Madatte is basically occur uttara kala, means initially there is a craving, then development of the tolerance, and then when the physical dependence occur, then we can label it as a madatte. And this not happens within a short period of a time. It take a time. It might be a 1 year, it might be a 2 year, it might be a 3 year. So it occurs basically after uttara kalam, means after a long period of a time means it depends from person to person. Suppose a particular person consuming the alcohol in a heavy concentration, like in the form of whiskey or in the country liquor, and if his frequency is frequently is consuming the alcohol, and even is consuming the alcohol for a large in a large quantity, definitely this madatte occur, or this physical dependence occur very quickly. But if the person gradually consuming the alcohol in a little bit amount or a little bit frequency, so it takes times to convert it into the physical dependence. So in this way, we have to understand this alcohol addiction through the madatte samprapti. So this is just a proper flow chart I'm trying to analyze through the Ayurveda and the modern concept that Vasanitva means the habitual indulgence in alcohol or any substance disorder. Gradually develops the craving and the tolerance. And in this way, the physical and the mental distress occur, which we call as dukkha, or in the long term, we call it as a loss of control or the withdrawal or the social dysfunction. And this way, due to the vasanitva or the habitual substance indulgence over a time, in a udarkarup, the person is supposed to be suffered from this alcohol withdrawal symptom, which we call as a madatte. Now, what is the approach for the management of the alcohol addiction? I'm just quickly summarizing all those things. This is the most important thing. Whenever in our IPD or our OPD, the patient reported to us, we are always screen the patient through this audit scale. So early screening of the alcohol use disorder patients or the patient who are having the history of the alcohol consumption through this audit scale. This is a scale which is developed by the WHO, which is a 10 questionnaire based scale, which not only which assess the alcohol consumption pattern, which assess your dependent symptoms, which assess the harmful use and its consequences, and after that we can label that what is the severity of that particular alcohol consumption, which we call as alcohol use disorder. We label it as alcohol use disorder, and according to the severity, according to the score, we categorize it into the different categories. Like if the audit score is in between the 0 to 7, then it considered to be a low risk. So there is just a brief intervention we have to give in the form of the counseling, that it's very harmful, it affects your liver, it affects your brain, so you have to stop consuming the alcohol. Likewise, you have to give a brief counseling sessions to this patient. So I request to all the faculty members and all the practitioners that whenever the patient get a history of an alcohol consumption, we always assess the patient, we always assess the severity of their alcohol consumption through this audit scale, so that we can get an idea that in which category that particular alcohol consuming person falls. So if it is in the low risk category, definitely you just suggest that it is a wrong habit, or it is you have to quit because later on it is responsible or contributing for so many disease conditions. But if the patient is in a medium risk or a high risk, or definitely if the score is about 20, definitely they have the possible dependence and the physical dependence. And once they stop the alcohol consumption, they definitely develop the alcohol withdrawal symptoms also. So here we have to categorize the risk of these patients, and accordingly we have to deal the patient. And very often I would like to say, what is my observation is that the patient who having the audit score in between 18 to 15 or 16 to 19 also, they have also some sort of an alcohol withdrawal symptom. Once they quit from the alcohol, reduce the alcohol quantity, they develop some sort of an withdrawal symptom. Though it is not significant, but definitely they have some sort of an alcohol withdrawal symptom. So there is no need that the audit score, if your audit score is more than 20, then and then only you will be physical dependent, or then and then only you are in a severe risk category, and then only the withdrawal symptoms will develop. No. If your audit score is more than 8 and below 20, you may experience with this alcohol withdrawal symptom. So whenever patient reported to your OPD, and if he is giving or she is giving an alcohol consumption history, it's your utmost duty to assess that patient through the audit scale. Now this is again, most of the time we are talking about the alcohol withdrawal symptoms, but in the different research publications, they have given which are the first degree alcohol withdrawal symptoms, which we call as a minor withdrawal symptoms, which once you stop the alcohol consumptions, they are basically the time of onset of these alcohol withdrawal symptoms basically occur in between 6 to 12 hours after stopping the alcohol. And what are the signs and symptoms of these minor withdrawal symptoms? That is nausea, vomiting, anxiety, mild agitation, diaphoresis, tremors, insomnia, mild tachycardia, tachypnea, hypothermia, hypertension, often termed as a tremulous state. So these are the very common alcohol withdrawal symptoms which we observe in the patients, which is a first degree or the minor alcohol withdrawal symptoms. What are second degree alcohol withdrawal symptoms, which particularly as alcoholic hallucinations. ये बहुत ज्यादा पेशेंट हमारे पास अल्कोहलिक हेलुसिनेशंस के साथ, मतलब जैसे ये फर्स्ट डिग्री अल्कोहल विड्रॉल सिम्टम्स के पेशेंट्स तो हमेशा ही हमें देखने को मिलेंगे, बट the patients who are reported with the alcoholic hallucinations, like in the form of tactile hallucination or the visual hallucination or other types of the hallucinations, they are not in that much, मतलब उनका prevalence आपको इतना ज़्यादा नहीं मिलेगा. And these second degree alcohol withdrawal symptoms basically appear after 12 to 24 hours of stopping the alcohol consumption. So this is basically the difference. The third degree alcohol withdrawals is called as alcohol withdrawal seizures, which appears after stopping the alcohol, and that appears after 24 to 48 hours of the stopping of the alcohol. And these are in the form of the generalized clonic tonic seizures with a short or no prostacal period. And the fourth degree alcohol withdrawal symptom, which is we call as delirium tremens, which is, अगर आप देखेंगे कि जैसे 100 अल्कोहल विड्रॉल सिम्टम्स के पेशेंट अगर आप देखेंगे तो 10 पेशेंट्स में आपको ये डिलीरियम ट्रीमन्स की हिस्ट्री जो है या डिलीरियम ट्रीमन्स जैसे सीवियर विड्रॉल सिम्टम्स आपको मिलेंगे. So usually what we observe in our OPD and IPD, that we are most of the time we are facing with these minor withdrawal symptoms or the first degree withdrawal symptoms. Very few times we are dealing with the second degree alcohol withdrawal symptoms like alcoholic hallucinosis, and I have seen only 2 to 3 patients who having the third degree alcohol withdrawal symptoms, who having in the previous history of the alcohol withdrawal seizure. And till it means right now we have started the de-addiction unit in 2016. Till date I have never seen any patient of this delirium tremens. So because the prevalence rate of this delirium tremens is very less, it is occur particularly in 5 to 10% of the alcohol withdrawal patient. That's why we have not yet seen the patient of the delirium tremens. But we are always dealing with this first degree alcohol withdrawal symptom, second degree alcohol withdrawal symptom, and the third degree alcohol withdrawal symptom. In that too, we are mostly managing this first degree alcohol withdrawal symptom. So you have to very you have to be very pertinent about that. What are the first degree alcohol withdrawal symptoms? What are your limitations? If you have a psychiatrist opinion or the psychiatric setup, so you can manage this third degree and fourth degree kind of the alcohol withdrawal symptom. But if you don't have that much of a setup, you can do the you can very well manage this first degree and the second degree alcohol withdrawal symptoms. Now, though the patients having the different types of the alcohol withdrawal symptoms, like first degree alcohol withdrawal symptom, but we have to grade it on the level of the SIVA score. So this is, I think you are well aware about this SIVA score. This is a clinical institute withdrawal assessment for the alcohol, and these are the 10 symptoms, and we are graded on the scale from 0 to 7, and the total score will be of ranging from 0 to 67. So if we are evaluating the severity of this alcohol withdrawal symptoms on the basis of the SIVA score, if the score is between 0 to 9, we will consider it as a mild withdrawals. If the score is between the 10 to 19, we are consider it as a moderate withdrawal. And if the score is more than 20, then it is considered to be a severe withdrawal score. But that doesn't mean that the means here the delirium tremens के patient आपको मिले, delirium tremens के patient ही होंगे तो ही आपका alcohol withdrawal score जो more than 20 होगा, ऐसा जरूरी नहीं है. आप first degree alcohol withdrawal symptoms में भी आप उसकी severity, जैसे suppose किसी को nausea vomiting है और वो nausea vomiting 7 degree लेवल का होगा, इतने इंटेंसिटी का अगर होगा तो डेफिनेटली आपका स्कोर जो है वो मोर देन 20 फर्स्ट डिग्री विड्रॉल सिम्टम्स में भी आपको दिखाई देगा, माइनर विड्रॉल सिम्टम्स में भी दिखाई देगा. सो इन दिस वे you can analyze or you can assess the severity of this alcohol withdrawal symptoms based on the SIVA score. This is just an observation. Recently, we have completed one PHI project where we have analyzed more than 35,000 of the populations of Jamaramgarh Tehsil. And out of that, we have screened near about more than 10,000 household families in which they having an alcohol consumption history. And then we assess those patients on the audit score. And what we observe, near about out of that 35,000 screen population, we get near about 2,508 patients who having a history of the alcohol consumption. And then we screen those population according to the audits, with the help of the audit scale. And according to that, we get this result, the risk category, that we observe 376% patient, that's 50% patient who are fall in this low risk category. Maximum patients, like 53.33% population, are fall under this medium risk category. 22% population fall under this high risk category, and only 9.6%, like 242 screen population, like out of this 2,508 patients, only 242 patient have a severe audit risk level. So this is just an observation which I wanted to share with all of you. This is the risk category or the risk category distribution of the patient. Now out of that 2508 में से हमने 1000 पेशेंट को हमारे क्लिनिकल ट्रायल में, हमारे इंटरवेंशन में हमने इनकॉर्पोरेट किया था. आउट ऑफ दैट वी गेट, बिकॉज 2500 में से कुछ ऐसे पेशेंट भी थे जो विलिंगनेस नहीं दिखा रहे थे और दोज दे डोंट वांट टू इनकॉर्पोरेट अंडर दिस इंटरवेंशन, सो वी जस्ट ओमिट आउट some patients having the severe third degree or the fourth degree alcohol withdrawal symptoms, or even they have the associated alcoholic liver disease. So we exclude all those patients, and then we selected 1,000 patients for the intervention. And in this series, we observe that near about 205, that is 25.5% patient are fall under this medium risk. 55.3% patients fall under this high risk, and 24% patients fall under this severe risk. This is just in the data. As we have recently completed our PHI project, where we have given the Khajuradi mantra, Srikhanda Sau, Smriti Sagar Ras for 1 month, and later on we given the Kushmandavaliya for the 2 months. And in this way, this is an observational data which we observe through that screen population. Even you also see, we also assess the severity of their alcohol withdrawal symptoms. So if you see that near about 67% of patients, what we observe, they're having the mild alcohol withdrawal symptoms. Means their CIVA score is between the 0 to 9 score. 32% of patients observe they're having their CIVA score in between 10 to 19, which is a moderate CIVA score. And only 0.4% population, what we observe, who having the CIVA score more than 20. So later on, we given the intervention, and after 6 months of follow, what improvement observed in the CIVA score that has been depicted in this table. But I'm not going in detail with that observation because we have to discuss the cases also. So finally, why we have to treat this moderate and high risk alcohol use disorder patient despite having the mild and the moderate CIVA score? Because in so many articles, it has been said that the patient who having the mild alcohol withdrawal symptoms or the moderate alcohol withdrawal symptoms, they are automatically subsided over a period of a time. Means अगर आपने 7 दिन तक उसको वैसे ही रखा without giving any sort of an intervention, so automatically it disappears. That mild and moderate CIVA, that mild and moderate alcohol withdrawal symptoms automatically disappear. So there is no need to give that much of an intervention. So in the psychiatric department, what we observe that they are most of the time dealing with the severe alcohol withdrawal, like delirium tremens, or the alcoholic hallucinations, or the second degree withdrawals, or the third degree withdrawal, and the delirium tremens. But most of the journals, what I have studied, that we can deal these mild to moderate withdrawal symptoms at a OPD level, and just give the little bit the thiamine supplements and all those kind of a thing, and just manage accordingly. But I think there is a need of addressing this mild to moderate alcohol withdrawal symptoms also, because there is a very wonderful phenomenon is there, which is we call as a kindling phenomenon. What is this kindling phenomenon? This is basically basically a body's physiology, that if you are not treating the alcohol withdrawal symptoms, or if you are not treating the minimal alcohol withdrawal symptoms, or if you are overlook the minimal alcohol withdrawal symptoms, your brain become more sensitive after each alcohol withdrawals. Means अगर आपने उस alcohol withdrawal को treat नहीं किया, तो and if you are neglecting that, or if you are overlooked that particular minimal alcohol withdrawal, your nervous system, your brain become more sensitive for the next alcohol withdrawal symptoms. So if the withdrawal is not treated, brain reacts more strongly for the next time. So that is basically a kindling phenomenon. That is a process where the brain becomes increasingly hyper responsive or hyper excitable. So if you are addressing this minimal withdrawal symptoms in the early stage, definitely that will not so the kindling process get arrested at that level. So it's very essential to address this mild and moderate withdrawal symptoms also. And this kindling increases the risk of the seizures, delirium tremens, and the severe future withdrawals. And that's why we have to address we were reporting with a moderate risk of alcohol use disorder patient, or the severe risk of the alcohol use disorder patient having the mild to moderate alcohol withdrawal symptom, but still we have to address those issues to prevent the severe withdrawal symptoms. Now, what is the why Ayurveda intervention is needed in the alcohol addiction? So, as you all know that whenever because there is no the specialized branch we have developed in the Ayurveda system of medicine, that is Manas Vikar. Because in the allopathy system of medicine, there is a specialized branch which is we call as a psychiatry department. Many psychiatrists come to here in the NI, and they ask that being as a toxicologist, why you are dealing this psychiatric part, like why you are working in this alcohol or substance abuse disorder kind of a thing, because this is a part of a psychiatry. But I think there is a need of a development of this Manas Vikar, Ayurvedic Manas Vikar. So that would be grateful for the Ayurvedic people also. So most of the time, the people, they are going to the allopathic practitioners or to the psychiatrist, and they are dealing with this alcohol addiction and managing the alcohol withdrawal symptoms with this gold standard treatment medicine, that is we call as a benzodiazepam. It is a diazepam and a lorazepam, which carried itself a risk of the dependence. और काफी बार हमारे पास ऐसे पेशेंट आते हैं कि they have an alcohol dependence, But for that alcohol dependence, they are taking the antipsychotic medications or the psychiatric medications. And along with this alcohol dependence, they are dependent to those medication also. So we have to deal with both kind of the dependence, alcohol addiction dependent. At the same time, simultaneously, we have to deal with the psychiatric drug dependence also. That leads to side effects like drowsiness, liver toxicity, dementia, and cognitive impairment. In this series, I would like to highlight just this particular book, which is written by this Dr. Grace Elizabeth Jackson. She's a very famous psychiatrist who is practicing in USA, and she wrote a very wonderful book, which is called as Drug-Induced Dementia: A Perfect Crime. And what she integrates, that she collected all the researches for publication of these books, or to substantiate her observation, that she integrated the research findings from the different epidemiological studies, like observational studies of the patients in the real world. Even she quoted the basic biology, that is animal experiments, the clinical science, and the neuroimaging and autopsy studies, in order to demonstrate the dementing and the deadly effect of these psychiatric drugs. And so why I'm telling all these things, because these psychotic drugs or these antipsychotics or the antidepressants or the anxiolytics or the mood stabilizers or the stimulants, all these are definitely responsible for disturbing your nervous system, disturbing your nervous circuits, disturbing your neurotransmitter equilibrium, and that also affects the neurodegenerations, which results in the drug-induced dementia kind of a thing. So that could be responsible for the different types of the disease conditions like Alzheimer's disease and so many other psychiatric disorders also. So in this way, that's why I'm telling all these things, because these medications also have the bad sides, that is in the form of the different side effects, like in the form of drowsiness, liver toxicity, dementia, cognitive impairment. Similarly, we are very oftenly used this disulfiram, which is used as aversion therapy. Means once the patient consumes the disulfiram and after that he consumes the alcohol, he develops some unpleasant sensation in the form of the nausea, vomiting, burning sensation all over the body, or the severe abdominal pain. And that leads to the serious side effects like the hepatotoxicity, neuropathy, and the psychosis, which often leads to the poor patient compliance. Even there is a lack of the mental and the emotional healing. The focus is very much less. And that's why even the lack of individualized approach is also not there. And that's why Ayurveda system of medicine plays a significant role to address this burning issue. This is what the holistic Ayurveda care, what we have given. Now come to the Ayurveda treatment principles. I'm just shortly summarize these things. Now, whatever the things we are giving to the patient, what is our ultimate aim? To provide the Sukhava Anubhuti to that particular patient. So in what form we have to give that Sukhava Anubhuti? In the form of Aushadha, in the form of Anna, or in the form of the Vihara. So Aushadha Anna Viharana Upayogam Sukhavam Vidya Upashayam Vyadhe. Means अगर हम कोई भी औषध, कोई भी अन्न या कोई भी विहार उस पेशेंट को प्रिस्क्राइब करते हैं, that leads to the Sukhava Anubhuti, or which subsided its symptoms, which we call as a Upashaya. And that is a perfect prescription for that particular patient. And in that too, we have to assess the different aspects when we are dealing with the patient. That is Dusham, Desham, Balam, Kalam, Mandalam, Prakruti. We all know all these things, which basically cater the individualized approach for each patient. And accordingly, we have to assess the Anshansha Kalpana of dosha, and accordingly, we have to select the Aushadhi also. And when we are adopting all these basic principles of the Ayurveda, then we will never get unsuccess when we are dealing these kind of the patient. So for managing the alcohol addiction particularly, there is a specific Chikitsa Sutra we have to understand, and Vagbhatacharya have definitely give a very emphasizing the role of this Madya Prayog in the management of the alcohol addiction. So what did he say? That yam dosham adhikam paschet tasyado pratikaret kafasthananu kurvacha tulya dosham adhate. So kafasthananu kurva chikitsa we have to do. So what is mean by the kafasthana? So urak kantha shirak kloma parvanya ama shayorasa Medo Granam cha Jivasya Kapasya Sutaram Uraha. So you have to deal with this Urak Kanta Shira Pradesh. Like we have to focus on the nervous system, you have to focus on the Amashay. So Nabhistanantara Janto Amashay. That means you have to focus on your Agni, you have to focus on your gut microbiome, you have to correct the gut dysbiosis. So in this way, you have to deal with this Kapasthananupurva Chikitsa. At the same time, he also quoted that Hina Mithyadi Pitena Yo Vadirupa Jayate, Sama Pitena Taineva Samadhirupa Shantati. So Madhya se Vishan Adrushyat, Visham Tutkarsha Vrittivi, Tikshnadi Gune Yogat, Vishantara Apekshati. So it is a classical example. You all know that there are 18 types of the Upashaya, and there is a one type of Upashaya, that is Hetu Vyadhi Vipritarthakari Anna. It is a type of upashaya where means मद्य की वजह से मदात्य हुआ है और उस मदात्य को ट्रीट करने के लिए मद्य का ही प्रयोग आपको अन्न के रूप में करना है, आपको आहार के रूप में ही करना है. So that is a classical example of the hetu vyadhi vipritarthakari anna, and that's why we have to judiciously use the different types of the madhya for dealing this alcohol addiction, for dealing for managing this alcohol withdrawal symptoms. And that's why this is the Falashruti of the Madhya, that how this Madhya act on a different level. That Madhya is basically a Deepan, Rochan, it is Tushtikara, Pushtikara, it is Sara in nature, it is Swara, Arogya, Pratibha, Varnakrut Lagu, it is indicated for the Nashta Nidra and Ati Nidra. That means most of the time we are seeing that in alcohol withdrawal symptoms, loss of sleep or disturbed sleep is there. The insomnia is a very prevalent symptom we occur. So here, the Nashta Nidra, the alcohol or the Madhya is indicated. Even it is indicated for the Krusha Vyakti, it is indicated for the Stula Vyakti, it is Sukshma and Stroto Vishuddhanakara. And in this way, these are the large Falashrutis there, and that's why you have to use the Madhya for dealing with this alcohol withdrawal symptoms. So this is the this reflects the Ayurvedic principle where the causative agent, when given in a control, and particularly in a food-like form, like in the form, that definitely reverse the disease process, that definitely reverse the alcohol, managing the alcohol withdrawal symptoms in a very proper manner. This is the one article I have written. I have very briefly that how this alcohol disturb the gut-brain axis, how it disturb the gut-liver axis, and how the gut this particular Madhya Varga, that is polyherbal fermented traditional medicine, which we call as a microbial consortium, which consists of a very good kind of pathological, beneficial bacteria. If you are ingesting it, definitely it will help to correct this gut microbiome dysbiosis. There are very few studies yet to be carried out where we are not yet analyzing the microbial consortium of different asavarishta. Like we are in day-to-day practice, we are using initially we are using the Ashwagandharishta, Draksharishta, Saraswatarishta. When we don't know, तब हमें पता नहीं था कोटक्कल का श्रीखंडा सो भी मार्केट में आता है. Then we come to know that yes, there is an Kottakkal company providing this Srikhanda. So then we are using the Srikhanda, so which is particularly indicated in the Madatte Prakarana to manage this alcohol withdrawal symptoms. So very few studies are carried out where the microbial consortium of these asavarishta are analyzed. So that if you are analyzing this microbial consortium, so that we can get an idea that what kind of the beneficial bacteria or the beneficial that bacteria is present in that asavarishta or present in the Srikhanda. So because that is a rich source of the probiotics, and once you are consuming that probiotic, definitely that modulate the gut dysbiosis. So here I briefly describe all these things, how it corrects the gut, liver, and the brain axis. So in shortly, I will summarize that this polyherbal fermented traditional medicines, which we call as a Madhya Varga, and where we are largely using this Srikhanda, so Ashwagandharishta, Draksharishta, to restore the gut microbiome balance. It contains the naturally fermented probiotics in the form of lactobacillus, Saccharomyces. This is all the theoretical aspect. We have to analyze it by doing the gut microbiome analysis with the collaboration with the different transdisciplinary researchers. But this is a part so that we can give a justification that how our medicine work and why you are giving this kind of the medication to particular this disease entity. So this promotes the growth of the beneficial flora. Even the ingredients which is present in these Asavarishta in this Madhya Varga, that is the Triphala, Trikatu and Vidang, and so many ingredients are there which acts as a prebiotic which enhances the microbial diversity. It also helpful for reducing the inflammation by decreasing the LPS, that is lipopolysaccharides induced endotoxemia. That also increases the anti-inflammatory cytokines. It decreases the TNF alpha and interleukin 6, which is responsible for modulating the liver and the brain inflammation. That, and particularly this alcohol crosses the blood-brain barrier. So there are only two things that crosses the blood-brain barrier. One is the lipid media or the lipid-based medicines, and second is the alcohol-based medicines. So particularly as alcohol make this negative neuroplasticity. So to correct that negative neuroplasticity, the medicine has to cross the blood-brain barrier and act on the brain to make it into the positive neuroplasticity. So for that matter also, it's very apt to use the medicated alcohol in the form of Srikhanda so and in the form of Ashwagandha Rishta or Saraswata Rishta or whatever the availability is there. So definitely it improves the gut barrier integrity. It is basically a Deepan Rochan. It is Agni Vardhak in nature. So definitely it enhances, it corrects the gut dysbiosis, it enhances the tight junction and the mucosal health, and it promotes the, as if you are going to modulate the gut dysbiosis, definitely the short chain fatty acids also, the production of these short chain fatty acids also get promoted, and which supports the gut lining and that enhance the immunity and all those things. So in this nutshell, why am I going to tell all these things? Because this medicated alcohol or this medicated Madhya Varga or this polyherbal fermented traditional medicines is meant for correcting the gut dysbiosis, which we call as we are treating the Kaphasthananupurva Chikitsa, or we are doing the Agni Chikitsa, and then how this, when we are doing this Agni Chikitsa in a proper way, how it affects to the different system. This is in this what I am going to explain. This is the Khajuradi Mantra. We are always using the Khajuradi Mantra as a food supplement. So most of the time we advise or we give the the mixture of this all the ingredients to the patients, and we made a one pamphlet where we briefly describe the whole procedure how to prepare the Khajuradi Mantra. And then the patient prepared that Khajuradi Mantra at their own house, and they are mixed, and then they are consuming this Khajuradi Mantra, which is mixed with this Srikhanda so or the Saraswata Rishta or Ashwagandha Rishta according to the availability. And in this way, we are giving this Khajuradi Mantra to correct the nutritional deficiency, because Khajurat Dadimat Draksha Tintirika Amlika Amalakehi Saparushuka Kruto Manto Sarva Madhya Vikaru. So this is the Padashruti of this Khajuradi Mantra. So whatever the the side effects or whatever the toxic outcomes occur because of this alcohol, that has been corrected by this Khajuradi Mantra. That's why it is labeled as a Sarva Madhya Vikaru. So that's why I think the use of the Khajuradi Mantra is a very apt option for managing this alcohol withdrawal symptoms. This is we are giving in the packaging form. Even the Shastrakar also given a timeline for the Ayurvedic management of this alcohol withdrawal. That is Saptaham Ashtaratram va Kurrat Panatrem Aushadam Jiryati Etavatam Panam Kalena Yuktashiltaha. So initially you have to manage the acute withdrawal symptom within the 7 days. According to we have to adjust the dose of the Srikhanda so Khajuradi Mantra, and we have to manage all those things with the help of this detoxification by using the medicated alcohol, like in the form of Srikhanda, so like Saraswata Rishta, Ashwagandha Rishta, and that help to restore your Agni, that help to restore the liver function and stabilize the Man. At the same time, we have to do also the Harshani Chikitsa, Satvavaya Chikitsa. The counseling plays a very significant role. तो काउंसलिंग बहुत एडवांस लेवल की काउंसलिंग आप इसमें इनिशियल लेवल पे नहीं कर सकते हैं, बिकॉज इनिशियली पेशेंट हैविंग a physical dependence, they having the alcohol withdrawal symptoms, so he is very much disturbed with that alcohol withdrawal symptom. So initially we have to manage those alcohol withdrawal symptoms. At a time, little bit counseling we can adopt. At the same time, we have to make an Harshana Chikitsa. You have to make a patient in a comfortable environment, in a proper environment, so that he will feel comfortable. He will means he should feel a friendly environment with that particular managing doctor also, so that he can share all the miseries and all the problems with that particular person. And later on, we can shift to the post detox or recovery phase. And that's why the Shastra also mentioned that param tato anubandhati yogastasya bhejam yatha yatham prayunjita kruta pranatya aushadam. Means after 7 days of a treatment, after complete management, whatever the anubandha of the symptoms are there, you can use the bheshaj or the medicine accordingly and treat that particular symptoms accordingly. Like the residual complications, like the liver dysfunctions might be there, or dhatu kshay might be there in the form of tissue depletion. So in that way, we can correct all those things by giving the rasayan chikitsa or the brahmana chikitsa for correcting this neuroplasticity and the vitality. And that's why Shastrakara very highly emphasizes this particular shlok, that is Sanshuddha Shamanat Deshu Madadosha Pradeshyopi Na Chit Chamyat Kafik Shine Jate Dorbalya Lagave Tasya Madhya Vidagdasya Vata Pittadikasya Cha Grishmopataptasya Tayor Yatha Varsham Tathapaya. That means कि आपको कफ को क्षीण करना है, मीन्स यू हैव टू फर्स्ट करेक्ट द अग्नि धातु, बिकॉज कफ वृद्धि का पहला लक्षण ही क्या है, श्लेष्मा अग्नि सदनम प्रसेका आलस्य गौरवम शैत्य शैत्य शतांगत्वम श्वास का सदिंतरता. These are the कफ वृद्धि का लक्षण. तो अग्नि सदन is a mostly occur in the alcohol addicted patient, in the alcohol withdrawal patient, and that's why you have to first reduce the amavastha, reduce the you have to kapha vruddha avastha, you have to make the vata pittottar avastha, and then you have to administer the dugdha pana or the ghruta pana or any rasayana, like we are using the kushmandavali here, or we can use the medicated kshira pana, which is mixed with kalyanaka ghruta or panchagavya ghruta or brahmi ghruta or yashti madhu ghruta in the form of the medya rasayan. So in this way, initially we have to manage the acute alcohol withdrawal symptoms, and whatever the symptoms associated after the 7 days or 8 days of a treatment, then accordingly we have to select the medicines, we have to select the rasayan, appropriate rasayan and the bruhan chikitsa, and we have to incorporate all those things. Even in context of the sneha yogya vyakti, it is also mentioned that sveda sanshuddha madhya asakta chintaka, means the person who indulge in the madhya, he is highly recommended for this snehana yogya person. So you have to do the snehana chikitsa, but with the appropriate condition. Initially अगर patient आपके पास आया है, उसको नींद नहीं आ रही है और आप उसको शिरोधारा अगर कर रहे, that is absolutely a wrong thing, because सेक अभ्यंग पिचव बस्ती चेती मूर्ध तेल में से मूर्ध तेल के 4 प्रकार बताए गए हैं, उसमें शिरोधारा भी बताई गई है. तो हमने अगर तेल की शिरोधारा अगर इनिशियल डेज में अगर हमने कर दी, तो इट विल क्रिएट अ प्रॉब्लम टू दैट पर्टिकुलर पेशेंट, बिकॉज जैसे अभ्यंग जनरली नष्ट निद्रा के लिए जिन लोगों को लगता है कि भी निद्रा नहीं आ रही, दैट मींस देयर इज अ वात वृद्धि काइंड ऑफ अ लक्षण, सो यू हैव टू डू द अभ्यंग, सर्वांग अभ्यंग और पादाभ्यंग. बट in the context of dinacharya, it has been clearly mentioned that abhyangam acharet nityam sajara shramavata दुष्टि प्रसाद पुष्टि आयु स्वप्न सूत्र का दार्ढ्यकृत. और उसके बाद उन्होंने कॉन्ट्रा इंडिकेशन भी बता दी है. कृत संशोध अजीर्णिति, मतलब अजीर्ण व्यक्ति अगर है या जिसमें कफ वृद्धि के लक्षण है, ऐसे व्यक्ति को आपको अभ्यंग नहीं करना है. So similarly the same principle applies to here. In this particular alcohol withdrawal symptoms also applies. कि initially patient जब आते हैं तो they have an reduced appetite, they have an amavastha kind of a condition. So initially we have to give the srikhanda or the madhya kind of a treatment, and later on we have to proceed for this snehana chikitsa in the form of abhyanga, in the form of shirodhara, in the form of rasayana or the brumana. The same principle has been mentioned also in context of the jwara chikitsa, that kashayam pana pathyani dashaviti langite sarpi dadyat kafe mande vata pittotari jwari. Means what is the exact situation when you have to do the snehana chikitsa? You have to first do the kapha manda and you have to make an vata pittottara condition. Then and then only we have to administer the sarpi. Otherwise, pakveshu dosheshu amrutam, means if you are making the condition in a niramavastha, then if you administer the ghruta or any sort of an snigdha dravya, it could be a ambrosia kind of thing. But if you are administering a wrong avastha, then it becomes a visha condition or it becomes a toxic condition to that particular person. So in spite of subsiding the symptoms, we will aggravate the symptoms if you are selecting the wrong line of a treatment in a wrong avastha. So we have to be very cautious when we are giving any sort of a treatment. Like हमारे IPD में भी देखिए शक्कर बिल्कुल दिया नहीं जाता है, दूध के पैकेट सभी आईपीडी एडमिटेड पेशेंट्स को दिए जाते हैं। और आपको पता है कि आमाभिभूत कोष्ठस्य क्षीरम विषम अहेरिव कहा गया है। तो पेशेंट का अगर अग्नि मंद है, पेशेंट का एपेटाइट ठीक नहीं है, पेशेंट को मल प्रवृत्ति ठीक से हो नहीं रही है, एंड इफ ही इज कंज्यूमिंग द दुग्ध इन इनिशियल फेज ऑफ अ ट्रीटमेंट, कहा भी गया है कि मदात्य में तो दुग्धपान करने के लिए कहा गया है, but they have mentioned a specific stage, at what stage you have to administer the pair, at what stage you have to administer the ghrita, at what stage you have to advise the panchakarma procedures like shirodhara, basti or padabhyanga or so many things. So selection of the appropriate avastha of a disease condition is a very important thing. Then and then you will you get you get an instant results, or sadhyo raga rujashama जिसे कहते हैं कि you get immediate effect with that line of a treatment. So that is the most important thing. So this is again the Harshani Chikitsa or Sattvaja Chikitsa. These are the external positive stimuli which definitely helpful for increasing the BDNF, that is brain derived neurotrophic factor, which is responsible for developing the new synapses and for developing the neurotransmitter and all those things. And these are the different therapeutic strategies. This, along with the medicines and the ahara, we have to incorporate the proper vihar also, because the therapeutic strategies to promote the positive neuroplasticity through the external stimuli, which we call as a Harshani Chikitsa, and that is very well dealt in the Charaka Samhita, that is Vanani, Ramaniyani, Sapadma, Salila Shaya. Means we have to create a very positive atmosphere around that alcohol addicted patient so that he feel comfortable, that help for this external positive stimulation to enhance the BDNF, IGF-1 alpha, which is responsible for the new synaptogenesis and neuronal repair, and for other things. So that creates the positive neuroplasticity. At the same time, we can incorporate the cognitive training and the mental exercises, positive life events and environments and counseling and the psychotherapy. So these are the techniques which we can, if you incorporate along with Aushadha and Anna, definitely we get the positive results. So this is the Harshani Chikitsa, like we can engage the patients with the cognitive training and the mental exercises, like in the form of solving the puzzles, learning the new languages. So it is all the theoretical part, but we can practically implement on the patients. We are doing the frequent counseling and the psychotherapy to the patient. So that will definitely boost up the patient, and that converts the negative neuroplasticity into the positive neuroplasticity. So that all helps a lot. Now, lastly, this is a case discussion. So here I just summarized 5 to 6 cases. And there are so many cases. Even I think nearly on OPD basis, we are dealing with near about 10 to 15 alcohol addiction or different substance abuse patients are reported on a daily basis. And out of that, right now we have only 15 beds for the IPD facilities. So it's very difficult for us. So there is a huge queue for getting an admission in our de-addiction center also. But meanwhile, I just summarizes these cases here as we follow the same protocol which I earlier discussed in this current presentation. This is the case one. This is a one person having an age of 42, having an occupation as an electrician, and he spent near about 40 days for this IPD admission. And when he reported to our OPD with the presenting complaints of the anxiety, mild tremors, loss of appetite, nausea, vomiting, and insomnia, and he having a history of an alcohol consumptions. And once he stopped the alcohol consumption, he developed these kinds of the alcohol withdrawal symptoms. If you see the history of the presenting complaints, the patient was apparently asymptomatic. And when he began consuming alcohol approximately 20 years ago, initially he consumed about 2 to 3 quarters. 1 quarter is approximately 180 ml. So nearly he initially consuming the 540 ml of alcohol per day, and which is of a country liquor, desi daru wo pita tha, leta tha, along with 1 pouch of tobacco. So smokeless tobacco consumption he was saath mein kar raha tha. And over the past year, there was a significant increase in both the frequency and the quantity, which we call as a टॉलरेंस डेवलप होने की वजह से there is a significant increase in both the frequency and the quantity, with alcohol intake rising to 750 to more than 1 liter per day. And subsequently the patient experience, and once the patient stop for a while this alcohol consumption, he began to experience the alcohol withdrawal symptom, which we have mentioned earlier, which lead him to seek the medical help at NIOPD, following which he was admitted for the structured de-addiction treatment. And then we assess this patient with the help of this alcohol use disorder identification test. Accordingly, we analyze their audit score, and later on we also assess the alcohol withdrawal symptoms with the help of the SIVA score, and then we diagnose this patient as alcohol use disorder with a severe risk, along with the tobacco addiction also. And most of the time, it is often we see that most of the patient having the multiple addictions. ऐसे बहुत कम patients होते हैं कि जिनको सिर्फ alcohol addiction ही है. Right now there is an increasing trend where the patient having the multiple substance abuse disorder, like some people having the alcohol addiction simultaneously, they have the smokeless addiction, or some patient having the smoking tobacco addiction. So in this way, the multiple or the simultaneous multiple addiction also they have. So in this way, this is a diagnosis what we have diagnosed on the basis of the audit scale and the SIVA scale. This is the assessment of the patient before treatment. When we assess the patient on the basis of the audit scale, his score was 23, because it is an assessment tool. So we are only initially assess the audits, the patient on the audit scale. And then we are mostly assess the patient's alcohol withdrawal symptoms through the SIVA score. Before treatment, it was 16. And after giving the intervention, it was turned to 0. And these are the liver function tests where GGT is significantly raised in this patient, that is 327. GGT is a marker basically which is responsible for the chronic alcohol intake. It is a highly sensitive for the chronic alcohol intake, and that elevation often reflect the alcohol-induced liver injury, and even when the LFT are also normal. मतलब काफी बार ऐसे होता है कि LFT की रेंजेस जो है, LFT की फाइंडिंग जो है वो नॉर्मल रहती है, बट GGT की फाइंडिंग्स आपको एलिवेटेड मिलती है. सो दैट purely indicates that there is a chronic alcohol consumption, and which signifies the severe liver injury. So in this patient, we got this observation that is 327 unit. And after then we have administered the line of a treatment, the same line of a treatment which I earlier explained in a previous slide, that we are given the Srikhandaso in the dose of 40 ml, and we are usually given the Srikhandaso after food. Basically, initially the patient having the reduced appetite, so most of the time we are giving the medicated Pathakalpana, that I usually prescribe the Takra, which is mixed with Laja, because Laja is basically again Laja Strut Chardi Atisara Meda Miha Kapachidana. So it is Kafanashak, it is a Chardi Nashak in nature. So when the patient having the nausea or vomiting kind of a thing, or reduced appetite, so we are using the Takra, buttermilk, and then we added the Laja into the buttermilk and just dissolve that Laja into that Takra and just administer to the patient. Or in the form of Budga Yush, we are advising to this Pathakalpana. We are always emphasizes to enhance his appetite, to increase his appetite, and later on we advise the patient to take the Srikhandaso in this particular dose. The dose might be differ in some patient. Suppose certain patients who have a severe alcohol withdrawal symptoms, we also increase this dose up to 50 ml also. So that Srikhandaso, which is mixed with the Khajuradi Mantha, and we administer it after the food. And it depends upon the intervals. Sometimes we give in a BD dose, sometimes we are giving a TDS dose. So here in these patients, we have given in a TDS dose. Along with, we have given the Lavana Bhaskar Churna. Again, our main focus to correct the gut dysbiosis, to enhance the Agni, to restore the Agni. So we are giving this Lavana Bhaskar Churna in a Samana Kal. So Samano Agni Samipastita को ये समान काल में बताया गया है कि समानो मध्य इष्यते, मतलब खाना खाने के बीच में आपको देना है. So usually we advise this Lavana Bhaskar Churna, which is mixed with Takra in the Saman Kal. That is the most important part. Even in This is a common Pitta Shamak Yoga we are usually prescribed because of the Ushna Tikshnat, because considering the Ushna Tikshnatva of this Madya. So we are using the Pitta Shamak Yoga before food, along with as a liver for a liver support or the liver injury. We are giving this syrup MU. You can use Amil Cure DS like Amil Pharmaceuticals का Amil Cure DS आ सकता है, पल्त्रिकादि कुआथवटी आप दे सकते हैं, बिलवादी अगद आप दे सकते हैं. So depending upon the availability, we can use these kinds of the medicines to correct the liver functions. And as the patient has the tobacco consumption history, so we are using the Dashara Sanskar Churna, which is for the Danta Dhaman we are using, and Yashti Madhu sticks. So Yashti Madhu sticks, why we are using the Yashti Madhu sticks, or we are also advising the Khadiradi Gutika or Eladi Gutika to engage his mouth by keeping something in the mouth, so that the craving towards the tobacco consumption will be get reduced. So that's why we advise him to chew this Yashti Madhu sticks as per his craving. And with this treatment, with I think 50 days, we have given this treatment, and these observations we observe. And after 15 days of a treatment, we assess all the alcohol withdrawal symptoms get subsided, and again we analyze this alcohol withdrawal through the SIVA scale, and after treatment it becomes 0, and then it get discharged. And later on, after subsiding the alcohol withdrawal symptoms, again we are providing the proper counseling. We are giving the proper Harshana Chikitsa. At the same time, we are giving the depending upon the feasibility and the affordability of that patient. Otherwise, we are advising the Kushmandavale as a Madya, and we are using the Abraka Basma. Suppose some patient having a porn addiction history or Shukraksha is there, so we add a Trivanga Basma into that. So in this way, we are using the different rasayanas. Even we are also using the Rasonak Shirapaka, and for the Rason Shirpak, in the Rasayan Kal, we are administering that Rason Shirpak, which is mixed with this Kalyanaka Bruta to cross that blood-brain barrier and to make this positive neuroplasticity in that context. So in this way, we are giving this Rasayan Chikitsa for 2 to 3 months, and then we making the a proper follow. And most of the time, some patients definitely they are not fit. The frequency get obviously reduced, but some patients are again indulge for this alcohol consumption. So they need a proper counseling and a group counseling and individual counseling and Sattva-Vaja Chikitsa and the CBT kind of a thing. Even their stressor should be identified in a proper way and address that stressor in a proper way, so that we can make that particular person to quit from this alcohol addiction. This is the second case. Again, the same. There is no that much of difference. The same alcohol withdrawal symptoms we are commonly observe. This is a 28 male patient who is a supervisor by occupation, who stayed in a IPD for 12 days. And he also history and alcohol consumption. And once he stopped the alcohol consumption and reduced the frequency, he developed these alcohol withdrawal symptoms in the form of the loss of sleep, tremors, anxiety, loss of appetite, nausea, loss of weight. Even the weight is also get reduced in this patient. If you see the history of the presenting complaint, the patient was apparently asymptomatic until 9 years ago, when he started the consuming 180 ml of the whiskey. Again, I think when you are doing the audit scale, there is one question, that is how much amount of alcohol you are consuming. So we have to calculate the standard drink. For calculation of the standard drink, you have to know which brand he is using. Brand in the sense which means like whiskey, the beer, the alcohol concentration is near about 5 to 7%. In the whiskey, the alcohol concentration is near about 40 to 42%. So you have to ask which brand of the alcohol he is using, or which type of alcohol he is using, rather than brand, which type of alcohol he is using. So here he's using the highly concentrated alcohol in the form of whiskey, which is in the quantity of 180 ml or once every 50 days. Over the past 2 years, both the frequency and the quantity of the intake increase, which suggests that he developed the tolerance and reaching to 2 to 3 quarters. That is, now initially he consumed the 180 ml of the whiskey just over 15 days of an interval. But over the past 2 years, he developed the tolerance, and then his frequency also get increased, and its quantity is also get increased, and that shifted to 360 to 540 ml per week. and he began an experience of the withdrawal symptoms even after missing a single day of alcohol intake. And subsequently, that's why he admitted to the NID addiction ward for the comprehensive evaluation and the treatment. And we assess this again. We assess the same protocol we follow. We assess this patient on the audit scale, having the audit score 19, which comes under the uh, 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 high risk level, and the SIVA score is 11. Here in this patient, we get only the SIVA score of the 11. So that doesn't mean there is no need of an giving an intervention. So as he has only the alcohol addicted patient, so we have given a little bit interventions, not that much of medicines. So these are the its liver function test parameters. Here also the patient's GT level is highly increased, which is 119. In this patient also, we have given the same line of a treatment. Srikhanda and Khajuradi Mantra is a common drug of a treatment which we give in each and every patient. Initially, we are giving the Saraswatarishta, Shivagandharishta, and Rakshasa and all those things. But right now, we have a Kottakkal company, Srikhanda. So we are always using this Srikhanda and Khajuradi Mantra to each and every patient. Lavan Bhaskar Churna again in a Samankar, and for the liver support, we are giving the MU syrup. And after line of a treatment, his alcohol withdrawal symptoms get reduced, and when we assess the patient, its SIVA score, it become from 11 to 1. This is a third patient. Again, this is a 43 years age patient having the male, and he's handicapped by occupation, and he stayed here for the 40 days. Here we have given some sort of an Panchakarma procedures also. What are the presenting complaints? That the tremors, weakness, loss of appetite, sleeplessness, nausea, anxiety since 8 months, cough with sputum since 3 to 4 days, and nasal congestion since 1 month. What is the history of this presenting complaint? The patient was apparently asymptomatic initially and began consuming the alcohol, that is country liquor. Generally जो हमारे पास आने वाले patients हैं, they are mostly from the lower socio-economic status. So most of the patients, they are consuming the desi daru or the desi liquor. Occasionally, around 25 years ago, over time, the frequency and the quantity of the alcohol intake gradually increased. For the past 3 years, the patient has been consuming the alcohol regularly with the intake ranging between 400 to 600 ml per day. So in this way, he gradually developed the tolerance and the physical dependence. In addition, the patient had a history of the tobacco use, which was discontinued approximately 3 years ago. The patient reported to our OPD with the symptoms, with above alcohol withdrawal symptoms related to the chronic alcohol use, and was consequently advised admission to the de-addiction unit of our IPT for the further management and the structured de-addiction treatment. This is he has a past illness regarding as taking the medications also. He was on a medication, that is deoxycholic acid and alprazolam, for his anxiety and depression. And when we assess this patient on the audit scale and the SIVA score, we diagnose this patient as a severe risk likely to be dependent, as his audit score is 31 and its SIVA score is 30. So audit scale is basically 31. That means it is more than 20. And that's why it is a highly physically dependent patient. And when we assess the patient of the alcohol withdrawal symptoms, their alcohol withdrawal score is 13 basically. So it offers say that कि ऐसा जरूरी नहीं है कि जिस patient का patient physically dependent है, that means कि उसका SIVA score more than 20 होना चाहिए. It depends upon the severity. Symptoms develop हो सकते हैं, उसका gradation जो है वो कम ज्यादा हो सकते हैं. So accordingly, we have assessed this patient on the basis of the SIVA scale, and these are the liver function test. And in this patient, we have a very significant raise of this GGT level, that is 445 unit is there, and this is after treatment it get gradually decreased. Here what kind of a treatment we have given, that is Srikhanda, so Khajuradi Mantra, Lavan Bhaskar Churna. Again the same thing we have given. Here we add on one more thing, that is Saraswatarishta with Manas Mitra Vatikam at bedtime Nishikal, because Urdhvetrugat Vikar issue Nishikale Prashasate, it has been mentioned in the text. So we also administer the Asavarishta in the Nishikal also. सो श्रीखंडा सो हमने 2 बार दिया एंड सारस्वतारिष्ट हमने रात को सोते समय दिया हुआ है. एंड आफ्टर this Kalyana Dhruta and milk, this is a stage-wise treatment. Initially, for the 7 days, we have given only this Srikhanda, so Kajuradi Mantha, Lavan Bashkar, Amlu syrup, and Saraswatari and Manas Mitra Vatakam. And later on, after gaining Kafa Kshina Avastha, then we administer the ghee, that is Snehan, was done after 7 days of the Deepana Pachana Chikitsa. And later on, we also give the Sarvanga Abhyanga, Sveda, Shirodhara, and the Padabhyanga for the 10 days. And in this way, we got the significant result in this patient in the SIVA score also. This is the same case. This is a 40 years age patients. Same male, mostly we have the male patients who is a laborer by the occupation and having the presenting complaints like tremors, vomiting, loss of appetite, nausea, giddiness, sleepiness, anxiety. He has a history of seizures also, mild seizures he has, and last seizure was observed before 2 months. Even he fell down on a ground, and for that he has a bruise mark on the left knee, left foot, and the left hand, and the edema only on the foot. So in audit scale also there is a one question that is there any previous history of the injury because of this alcohol consumption. So here these kinds of the history definitely increase the score of the audit scale. So this is the presenting complaints of this particular patient. Now what is the history of the present illness? Again, the patient was apparently asymptomatic initially and began consuming the alcohol like Desi and commonly Desi Daru is consuming approximately 25 years ago at a dose of 180 ml per day. For the past 15 months, there has been a significant increase in both the frequency and quantity of the alcohol intake, now consuming up to 750 ml per day. So similarly, this indicates that as the frequency and the dose increases, the patient develops the tolerance, and once the patient stops the alcohol consumption, and if he develops the alcohol withdrawal symptoms, then we can finally diagnose that yes, he develops the physical dependence. So additionally, the patient has been chronically addicted to the tobacco in the form of BD. So this is a smoking form of the tobacco addiction with the history of smoking one bundle, that is approximately 20 BDs daily for the past 30 years. The patient presented to the OPD with the symptoms associated with the above substance use history and was advised for the admission in our de-addiction center for the comprehensive management. He has an history of the hypertension, but not on the medications. And again, we assess this patient on the basis of the audit scale and the SIVA scale. Here we observe the score. The audit score was 27 and the SIVA score was 37. So that is a very significant score. This is a severe alcohol withdrawal, severity of the alcohol withdrawal that indicates. And if you see the GGT level, here the GGT level is 620. And after given the treatment, it reduced to 120. The same line of a treatment here we have given only the one Cardocam, which is a Kotakal company medication, a proprietary medicine, which we have given for managing his hypertension, as he has a previous history of the hypertension and not on a allopathic medication. So for managing that hypertension symptom, we added this Cardocam. Otherwise, the same line of a treatment we have given to this patient also. And in this also, after giving the treatment, like he has admitted for 27 days. So after assessing their SIVA score, it get reduced to 0. So ultimately, the alcohol withdrawal symptoms also get reduced in this patient also. This is a current patient, and I have recorded his voice for the testimonial for this presentation. So this is a very interesting case. He's a retired army officer having the age of 42 years, and he took the voluntary retirement because of this alcohol, the high alcohol consumption. Along with that, he has a porn addiction also. So and he visited and actually his mother is a very renowned pathologist in the Jaipur. He's a retired former dean of the Ayurveda, the Ajmer Government Hospital, and his father was the retired dean from the Shimla Government Hospital. So in this way, and he's the only one son of this particular couple, and he's indulged in this alcohol consumptions for a long period of a time. and initially he has a porn addiction, and later on he's started to consume the alcohol and tobacco smoking also. So in when he reported to us, he having a presenting complaints with increased palpitation, restlessness, anxiety, loss of sleep, and a reduced appetite. This is the history of the present illness of this patient. The patient developed the pornography addiction at the age of 16 to 17 years, along with the habitual masturbation. At the 21 years after joining the army, he resumed the porn use and began alcohol consumption, reportedly under the peer and the stress influence. वहां पे आर्मी ऑफिस या आर्मी में जब वो गया था, आर्मी ट्रेनिंग में जब जाता था, तो उस समय वहाँ के जो उनके सीनियर्स थे, बिकॉज देयर इज अ वेरी कॉमन प्रैक्टिस फॉर अल्कोहल कंजम्पशन, सो एज अ स्टेटस सिंबल ही स्टार्टेड टू कंज्यूम द अल्कोहल. और आर्मी ऑफिसर में है, आप कहीं भी जाएंगे तो वहाँ पे अच्छे ब्रांड्स के आपको अल्कोहल्स आपको मिल जाते हैं. सो बिकॉज ऑफ द the senior peer pressures and the stress influence, he has started to consume the alcohol. And at the age of 25 to 26 year, his habits are intensified. And during that age, he got married, but alcohol consumption become frequent and uncontrolled, and abstinent phases were short-lived. And during this condition, his alcohol consumption frequencies also get enhanced and get increased, and that's why the means the absence in the workplace is frequently occur, and that's why he's always on a long use. Basically वो काफी समय तक long use पे रहता था, and that's why he voluntarily took the retirement from the army post. And then he also took the de-addiction treatment in 2015. And when he reported to us, he was taking, he has given the history that he was taking near about 16 allopathic psychiatric medications per day under the prior psychiatric care, and that developed also the medicine dependence. Currently, he is taking near about 5 to 6 medications. He is also separated from his spouse because of this problem for the last 4 to 5 years, having 2 children. And current symptoms, as he has the alcohol withdrawal syndrome like palpitation, restlessness, anxiety, insomnia, psychological symptoms, unpleasant dreams, suicidal thoughts, past self-harm attempt, and fear of the aversions like darkness and silence and loneliness. He is very much indulged with that kind of a thing. And porn addiction, definitely he has that frequency. I will have that prescription also. This is a prescription because of a lack of a time. We have a OPD एक दिन की रहती है, 50-60 पेशेंट रहते हैं, तो एडिक्शन के 7-8 पेशेंट हमारे पास डेली बेसिस पे आते हैं. अलॉन्ग विद दैट अदर डिजीज कंडीशन के पेशेंट्स भी आते हैं. तो दिस इज जस्ट अ प्रिस्क्रिप्शन सो दैट यू कैन, आपको ऐसा ना लगे कि भाई मैं जो बातें कह रहा हूँ, it is just all theoretical. That is basically also reflecting on my prescription also. So same medications I have given. And इस पेशेंट को इनिशियली उसकी मदर ने काफी इंसिस्ट करके आईपीडी एडमिशन के लिए कन्विंस किया. And she interacted with our vice chancellor sir, and with special permissions we shifted in a special ward. And just for 2 days of admission, he absconded from that thing. और 2 दिन के बाद ही, ट्रीटमेंट के बाद ही वो वहां से भाग गया. And then her mother is also get worried कि अरे, और I also get worried कि 2 दिन में ही ये भाग गया है. And later on the OPD basis level, we prescribe these kinds of the medication. Only the Srikhanda so Khajuradi Mantha, Amalaki Churna we are providing for making the Khajuradi Mantha. धान की खीर like छाछ में, जैसे मैं बताता हूँ, लवन भाजकर चूर्ण छाछ में मिलाने के लिए. We are always emphasizing on the पथ्य कल्पना like in the form of yavagu or the मूंग और मसूर की दाल और सेंजिन फलियों के सूप for enhancing his appetite. And रात को सोते समय निशी काल में मानस मित्र वटकम and one पित्त शामक योग in अपान काल, means before food, like प्रवाल पिष्टि, सहस्त्रपुटी अभ्रक भस्म, त्रिवंग भस्म. Why I given this त्रिवंग भस्म? Because of the masturbation habit, and as there is an involvement of the shukraksha in a maximum manner, so enhance the shukra dhatu, we add the trivanga bhasma or the trivanga bhasma in appropriate dose. So in this way we have given the line of a treatment, and this patient is particularly in the follow for 2 to 3 months, and now he is completely abstinent from the alcohol consumption, and he has not used the alcohol since the treatment was going on. And even this frequency of the porn movie watching is also get reduced. And now he has gotten a realization. Even we did a counseling session from the counselors who visited to our de-addiction center. So he gone through 2 or 3 sessions for the counseling sessions also, and now he get the positive hope for that thing, that I will be recover from this kind of the thing. और इसका अगर आप देखेंगे तो ये बंदा जो था ये मतलब पॉर्न देखने के लिए घर से निकल के होटल में चेक इन करता था, 4-5 दिन होटल में ही रहता था. He book a one room and then he smoked the cigarettes over there, consumed the alcohol and watched the porn till get satisfied and later on check out और फिर से वो घर को आता था. ऐसा इसका हैबिट जो है वो टोटल था. But right now he is completely staying in a home, not checking in the hotel for watching this porn and all those things. But yes, behavior addiction, that is called as a porn addiction, this frequencies get reduced, but alcohol consumption जो है, that is completely stop after starting this line of a treatment. So this is a brief presentation regarding this here. These are the kinds of the medicines. We just make a PowerPoint presentation that what kind of the medicines he is taking. And because there are so many antipsychotic drugs and the psychiatric medications he is indulging, so even we don't know also what is the indication. So we just take the photographs of those medicines and try to find out what are the indications of those medications. And because ultimately are taking the that antipsychotic drugs simultaneously, we have to reduce those medications also. So we are now gradually reducing the doses of all those medications gradually and stopping some sort of the medicines, but it is in a gradual phase. So this is the line of a treatment. This is the current prescription. Here we are giving after attaining the Kafakshina Avastha, we are advising the Kalyana Vruta with Rasun Shirpak in the morning time in the Rasayan Kat, and otherwise the same treatment. Like we were giving, this is in the Brumana Chikitsa in the form of Kalyana Vruta and in the form of the Rasun Shirpak. Otherwise, as there is an liver involvement and all those things, so we are prescribing the Bilvadi Gutika, taking into the consideration of the Garavishanashak property, and same treatment, that is Praval Pishti, Aparagvasma, Trivanga, Ampatti Karat, Pittantavyo, and other one Bashkarjo. So with these simple kind of the medications, we are dealing with these kinds of the patients. And this is his testimonial I'd like to share with all of you.
Good morning, ladies and gentlemen. I am a former Indian Army officer, presently settled in Jaipur, and getting my treatment from National Institute of Ayurveda, Jaipur, Agad Tantra Vibhag, and my principal doctor is Vaidya Amol Sudhakar, Kadu, who is a senior assistant professor in this institute. I'll summarize my entire de-addiction journey in the shortmost possible manner for you all. My treatment for de-addiction started around 8 to 10 years before rocking. Initially, I reported my alcohol addiction problem to the army authorities. So in the military hospitals, I have been treated for continuous 2 years. And after my release from the armed forces, I have been treated in civil hospitals for more than 6 to 8 years. And all were allopathy hospitals of the different psychologists and psychiatrists. So this was entirely a journey of treatment, healing, and repeated relapses. The good thing about my story is I was myself very much willing to give up this ugly habit, addiction. Since a stage has come when I realized this thing that now it is not me who is consuming the alcohol. Indeed, it is the alcohol which has started consuming me. It was doing its drastic effects on my health, plus my personal life, not to spare my professional life, and altogether. So I was myself very much willing to come out of this bad habit, the addiction. My military authorities and allopathic fraternity labeled this addiction as alcohol dependency syndrome. This is what they call in the medical terms. So I was fighting a disease. And the lighter side of this story is, entire of my professional life, I fought many enemies, but this time the battle was not with somebody else, but the battle was within. It is me versus me. I have to fight for an illness, against the illness. So I was trying my level best, but every time when I decided कि बस अब नहीं, this is the last pack of my life, अब शराब को हाथ नहीं लगाऊंगा, and I'm completely away from it. But that promise made by myself to me could not sustain for more than 7 to 15 days at max. And then again, the series of the same thing, relapses, hospital admissions, intensive treatments, counseling therapies, and that same cycle, same pattern was repeating over years. My family, including my parents, my children, my spouse, everybody has given up on me. कि भाई ये ठीक नहीं हो सकता, इसका बेस्ट पॉसिबल इलाज हर जगह से हमने करवा लो. Everybody was ready to give up, but not my mother. She was still stubborn, hard-stood. My son is not an old newspaper which can be thrown in the dustbin. I will revive his life. I discovered the ways. And in her journey of discovery, she discovered a beautiful institute which I mentioned in the initial intro of my talk, National Institute of Ayurveda, Jaipur. And here was functioning the de-addiction unit also, headed by a very qualified and a premium team for the change of the doctor. It was a change of the changing to an entirely new line of treatment. So I was going to run on a new track. Everything was new for me, the type of the treatment I was used to. It was nothing like it. So the treatment started with the IPD treatment and further progressed to the OPD treatment. I took the medicines. Volume of medicines were quite balanced as per my requirement. So initially the things were very alien to me. It took time for me to adopt the new therapy, the new way of therapy, a new way of treatment, and entirely, as the Ayurveda says, a new way of life. So it took me handsomely about a month or two to get adapted to the new treatment. But when I started seeing the change in myself, and the people around me started seeing the change in myself, in me, then I got motivated. And I started taking medicines by my own. Every time I was asking to my mother, अब कौन सी दवाई लेनी है, इसके बाद मुझे कौन सी थेरेपी लेनी है, अब क्या लेना है, because the things were showing results. And I'm happy to share with all of my audiences that now it is about to be a quarter of the year or more, around 4 months or so. I'm completely sober, completely abstinent from alcohol in any manner, and on my way of recovery. This is a big change in my life, for which I will always remain indebted to Dr. Amol Sudhakar, to this premium institute functioning in a very systematic manner called NIA, and in general, the great knowledge we have inherited from our ancestors in the terms of Ayurveda. Thank you so very much to be with me in here. Jai Hind.
So this is his testimony. He's recently visited to for the OPD consultation. So this is a one PHI project we are recently completed, and we just finished a PHI project workshop, the progress report workshop, where all the Ayush officials came to look out our this PHI project and their outcomes. So this is also presented in just 15 days back. So this is the whole team under the, as Dr. Professor Vaidya Sharma was the principal investigator of this project, and this project we have implemented in the Jambaramgarh Tehsil, where we have giving the Ayurvedic medicines like Khajuragi Mantra, Srikandaso, and Suryasagar Ras, and as a Madya Rasayan we have given the Kushmandavaliha, along with yoga counseling and the lifestyle modification. And this is our project team, Dr. Mukesh, Dr. Kishan, Dr. Mayank, and Dr. Suresh. And in this way, we have successfully implemented this project in the Jambaramgarh Tehsil. These are the interventions which we have given. This is the procedures which we have done in the IPD admitted patients. Here about 256 patients we have admitted for this PHI project under the IPD admission. Rest of the patients we have given the treatment at OPD level. And this is the final outcome, because as a time constraint, I'm not going in detail their outcomes because it took another 1.5 hours to discuss all those outcomes. But here, what we observed that out of 1,000 patients, near about 33.3% patients, means these patients are completely abstinent from the alcohol. 537 patients reduce their alcohol consumptions, and 130 patients have the relapse, that they are not stopping the alcohol drinking. So definitely counseling as well as the medicines, the food, and the way they are consuming the medicines, that all things are so much dependent on all those things. But what this outcome we have received, though the relapse and the alcohol consumption reduction is observed much more, but still the 33.3% of the total 1,000 patient is a significant number who are completely quit from the alcohol till 6 months of the follow. So this is a big change. I think we can make a big change through the Ayurvedic medicines. And I think now when we are giving, when we are assessing the symptomatic relief, we are assessing the the outcomes on the laboratory parameters also. Now we have to justify these results on the different scientific tool also. I recently attended a gut microbiome research workshop, where we can also justify these kinds of the results through the gut microbiome analysis with the help of this fecal matter sample. So how our medicines, how our microbial consortium modulate the gut microbiome dysbiosis, and how it correct the gut microbiome dysbiosis. So we can use the transdisciplinary researchers' helps to establish, to justify, to substantiate our findings in a very scientific manner. So in this way, there are lots of scope and lots of things to do. First, we have to do in a clinical domain, and then the lots of doors will be open for the clinical research. So this is our de-addiction, initial de-addiction center. This is this unit which is inaugurated by our Honorable Vice Chancellor, Professor Sanju Sharma sir, and this was our infrastructure. This is when on the foundation day, Dr. Pratap Rao Jadhav, the Ayush minister, who came here for inaugurating our de-addiction center. So it get converted into de-addiction unit to de-addiction center, and recently we also do the application for this de-addiction center also. And this is our PHI project workshop where we have presented the outcomes, what we have observed through this presentation. This is a one team, the WHO team. This is a Dr. Jagdish Kaur Madam. She's a technical officer of the WHO who is working in the tobacco-free initiatives. She also visited our Nasha Mukti means de-addiction center. And even right now, she is planning for implementing the tobacco de-addiction treatment modality. She's bring some capsules and extracts. So she wanted to give to the smokeless tobacco addiction patients. So in a very soon we will run that project also. So in this way, we are doing our work in this domain. So thank you for patient listening. And if there, I think that I took a lots of time. It's near about 5:27. So if you have any query or any questions, you can free to ask to me. Hello.
Yes, madam.
Yes, sir.
Any queries from the audience? I think raise the. Any audience? Have any questions? Yes, very nice and very thankful to your. Even though busy schedule, you came here and given lots of very good clinical knowledge about the de-addiction. But most of the institutes of Ayurveda colleges still they are in a very infantry stage. But they may take up your